My name is Bellamy Pascucci. My son Jonathan is 5, and my bonus kids are both 13-year-old twins, Maggie and Anthony. And my husband, we all reside in Vegas, and we love to do traveling, participate in sporting events, of course.
Can you share with us some of the reasons that you've needed to seek pediatric healthcare here in Nevada?
Oh, yes. So my son Jonathan was diagnosed in utero with Down syndrome. And then when he was born, he had a lot of medical complexities such as heart, GI challenges. He did really well with the heart, everything here. And then his pediatrician had referred us to the Down syndrome clinic in Phoenix, where he got some more diagnoses such as tethered spinal cord, pediatric feeding disorder. So we have been traveling to Phoenix since before the pandemic for endless specialist surgeries, things like that. And while they're great specialists here, I feel that there can be more.
Before you had your son, could you imagine a life of needing to access pediatric care on this level? So many people think that won't ever happen.
I never imagined when I first moved here I'd be able to have other children. So it was such a blessing and wonderful. And the journey's been a journey.
If you weren't able to travel out of the state, what would it be like for your family?
So I don't think Jonathan would be doing as well between wait lists and getting an autism diagnosis and those two things at the time. He's now 6, but he was 2.5, 3 at the time. Being a 2 to 3 year wait list, it would just be very detrimental to his health and his access to care and doing well like he is today.
Yeah, the wait times do seem a little bit burdensome for your family and for many families here in Nevada. What are some other observations that you've had as you've been navigating through the healthcare system for pediatrics in Nevada?
I love how all of the doctors are so caring and knowledgeable. I think there can be improvements with the freestanding children's hospitals so everyone can work together in the same building for access to care for patients. For example, when we go to Phoenix, we do his blood draw, and almost the same or a couple days we get all the results back. And if anything else comes up, the other specialist can refer us immediately to someone else, and it's real comprehensive care, which in turn cuts down on visits actually and procedures for Jonathan. If he recently had ear tubes, we can coordinate other things like his dental cleaning, and only having to be put under for anesthesia once would be great.
And navigating, that's another thing that you bring up, all the specialists that you do see here when you're not going out of town. What's it like to access all of those different specialists?
Oh, if we were to do that, I have a big file with each specialist, with each different end of summary visit, I'll say, of his healthcare. Versus when in a comprehensive pediatric system, you can log on to a patient portal and everything is there. And then his other specialists can read through it and say, oh, I see that this doctor's doing this. Let's try this, or he needs to be referred here. You know, it's not just one set of eyes looking at everything. All of our kids have so much potential when they get the right help. And that's the one thing I noticed with him, and the one thing his pediatrician noticed and supported, which is why we were referred out to Phoenix.
Can you tell us a little bit about what a trip to Phoenix looks like for you and Jonathan?
Yes. Without having family there, I don't know how we would do it. I guess I've had friends offer to stay there, but we fly on Southwest because the 5-hour drive can be taxing on myself, I'll be honest. With him, especially with his last ear tube surgery, we flew in, had his surgery, flew out in 2 days. It still can be, taxing and trying and stressful, and although I'm very grateful for it, the costs and everything do add up with that. But I'll do whatever it takes for Jonathan to give him what he needs.
Is your whole family traveling together?
Just ourselves. So then that takes time away from his dad. That takes time away from his brother and sister. That takes time away from his Miracle League activities, swim lessons, Gigi's Playhouse activities, Down Syndrome Connection activities, things, with typical peers. So Jonathan loves swimming. We just attended yesterday a child's birthday party, our best friends, at the water park. So he loves that. He loves participating in a lot of the singing classes. He loves to be very, very active, and he's a very social kid. And not having to travel all the time would help him be able to just keep living his best life. About 2 years ago, my son, when he was diagnosed with a pediatric feeding disorder, he did an intensive feeding clinic. So my husband had to quit his job, and I was down there every weekend because I still needed to work, and it was a real sacrifice For the bigger kids, not having their dad there and me missing my son, and while he got the help he needed, it would be really great to have more access to care and comprehensive children's hospital to be able to help families and medically fragile kids like Jonathan. Why I'm a big advocate for this is not just for Jonathan, but if I can save a family, the stuff that we've had to go through from separation and travel costs and things like that, that's why I want to do this. The freestanding children's hospital for comprehensive care is going to save time, money, stress for parents, better access to children, better everything.